And so if we can delay the onset of chronic disease, which we can absolutely do, if we get proactive and predictive and develop a strategy and a game plan, think of it like a business. If I know I've got to generate X amount of revenue in Q1, or in Q4, then I can follow the trends to see, am I leading towards that goal or initiative? If we work you through an assessment at Ways to Well and dig in, we know your bone mineral density. We know your visceral fat, your subcutaneous fat. We know all of your biomarkers. We know your genetics, your epigenetics, your family history. We put all that into the algorithm and we begin to get proactive and predictive. We've got a slow bone mineral density loss. One of the biggest risk factors over the age of 65 for women is a fracture, right? We know how much bone mineral density you're going to lose a year. This isn't rocket science. I am not that smart and I can figure this shit out. How can fucking guys from Harvard, Stanford, John Hopkins not be doing this? It's because all of them are captured in this broken system and everyone has plausible deniability.
What does it cost to get that assessment done?
A DEXA scan, a VO2 max is literally like $100-something combined. And then blood work is, with us and an hour with a clinician is $500. I mean, so less than $1,000, you could have a full workup, including an EEG, a brain scan, AI guided, everything done. And then you've got a blueprint. And then we load that into the AI algorithm. And what we're launching is a wearable. It ties into wearables. So we have those data sets, but then our AI is tied into a wearable. So we know your REM sleep, your deep sleep, your heart rate variability. And we're cross-referencing all of these data sets and proactively warning you if you're starting to head towards something that could be catastrophic. But that's where I go back to, we do not want this shit in the hands of the insurance companies. We don't. They're too corrupt.
I actually didn't plan this interview to be like an ad for your business, but this sounds really interesting. Where do you get this?
Well, I think a lot of people are doing this, so it's not unique to us. So I don't want people to think they have to go to us. I would implore people, if you've got the budget at minimal, like I know Dr. Hyman's doing comprehensive blood analysis. There's a ton of companies out there. And so the main thing is to truly, you and I were talking about carpentry earlier and our obsession with woodworks and making sure you curate the right, aesthetic.
So important.
People spend so much time and energy. If they are going to remodel their house, they'll interview 5 or 6 contractors. If they're going to get a car built, they'll go interview 3 or 4 mechanics. Why are you not doing that with your body? You only get one of these. And not all doctors are created equal. And if they're in that captured system and you're just blindly following the prescriptions and the drugs this person's telling you to take, you're doing you and your family a disservice. You need to do a deep dive and we need to make healthcare approachable and fun and understandable, where patients want to be a part of the journey. But the systems beat them up and spit them out. Yeah, and so our thing is like, can we make it fun again? Can we gamify it? Can we compete against our friends where you can show, hey, Tucker's biological age has moved backwards over the last year while your biological age has gone forward. He's beating you at the game. He's aging backwards because there's linear age, right? Like I'm 44. That's my linear age. But my biological age based off biomarkers is 35. I'm 9 years younger biologically, physiologically than I am in a linear age capacity. And that's all calculated by the AI algorithms. So I'm basically walking around like a healthy 35-year-old. And that's how we prevent chronic disease. We quit fucking around with writing a bunch of prescription drugs and we get proactive and predictive, and we could save billions, trillions. I mean, $1.5 trillion is what we spent last year.
Last question. Why wouldn't you cover that? Could you have a federal health insurance cover that?
That's
would
the
that
hope.
Destroy it?
That's what Callie and myself and that's what I wanted to talk to Bobby about. Like, you can't let the insurance company capture it, and we don't want the insurance company to have this data because it's dangerous. But could the federal government mandate that the insurance company gives you an allowance a year? Let's just say it's $5,000 a year to use to see a nutritionist, to see a dietitian, to get proactive and predictive, go to whatever clinic you prefer. The insurance reimburses the patient for it, or there's some sort of tax incentive to incentivize us to get
Congress requires the insurance companies to cover all kinds of things. So this is the opposite of a free
They
market.
do.
Right.
And my fear with that, though, is if the insurance companies get that, do they demand the data, and you don't want them having access to this, but this is where we're headed anyway. That's the scary part. That's the part of the equation.
So HIPAA protects nobody, really, it doesn't sound like.
Yeah, well, because the insurance company is going to claim medical necessity, and they're going to need to evaluate you in the model we have now. They go, well, I don't think there's medical necessity. I need to see this patient's records. And then they've got some primary care that they're paying that's a consultant to get on the phone and come up with creative ways to deny your claim. It's complicated.
Yeah, well, it's complicated, but it also, the big picture makes absolute sense.
If we drove metabolic disease, like Callie said, if we focused on preventing metabolic disease, we indirectly prevent all the chronic diseases that are killing so many Americans. The number one risk factor for the big 5 killers of humanity is smoking. Right?
Yeah.
And the second is age, but age isn't considered a chronic disease. So if we take out age, the number one risk factor, smoking. The number 2, metabolic disease and obesity. So even when we talk, somebody had, after we testified in front of the Senate, I think it was, I don't even want to give them, The Atlantic, those scumbags posted, woo-woo caucus. These people are idiots. What do they know about healthcare? They're claiming that diet impacts cancer. Yeah, you moron. It is literally the second most crucial thing to driving your cancer risk rates.
Why would it be important for The Atlantic, which is works on behalf of the CIA, fact, but why would it be important for them to lie about something like the link between diet and cancer?
Because there is, this is funny. Yes. Well, multiple reasons, but one is they are also captured. If you look at who previously owned The Atlantic, it was a lobbyist for all of the pharmacy benefit managers. Did you know that?
I didn't.
Yeah, and then they sold to Steve Jobs' widow, and she supports Michelle Obama and Kamala, and she was involved in that. It was more of, oh my God, if RFK stands for this and RFK backs Trump, we got to discredit these people. And again, that's what I said to the Senate. This is not a Republican issue. This is not a Democrat issue. This is a humanity issue.
Yes.
Stop with your party bullshit. Like, nobody cares. Stop trying to fuck us and help us fix this problem. I don't care who wants to get behind this, Republican or Democrat. I welcome it with open arms. Let's put our egos aside and work together to fix this. People are dying. It's insane. But as we peel back the layers, we went on Joe. Multiple articles came out. Joe and I pulled him up on Rogan. It was, I think, a week after I went and testified in front of the Senate. Joe and I on the podcast go through and methodically look. Monsanto. Multiple hatchet job articles were funded by Monsanto. Then I don't remember who wrote a hatchet job.
Of all the things you could attack that people say, why would people be angry at you for saying this? It's just interesting to me.
Well, it's because the funding for those articles come from these lobbying groups that are funded by big pharma, big food, big ag, and they're terrified.
I was a magazine reporter, and I know what it's like to be told by your editor, you should do a piece on this. And you have to think well, I'm probably being used in some way to settle some score or whatever. But if someone said attack someone for saying that there might be a link between what you eat and your health, I would say, I'm not going to do that. Do you know what I mean?
Yeah.
Of all the villains in the world, why am I attacking the guy who's pointing out, first of all,
one of the wildest,
obvious.
Tucker, and we went through this on Joe too, but it was, so I own these pharmacies, right?
Yeah.
We make a lot of the GLP-1s and weight loss drugs for pennies on the dollar, because it is, let's be real, this is not an obesity drug. It is a diabetes medication.
Right, yes.
And diabetes disproportionately, and it disproportionately impacts poverty-stricken communities,
of course,
minority communities.
Yeah.
They can't afford this fucking price, and they don't have insurance in a lot of those communities. So our goal is to bring cost-effective prescription medications to the masses to make this affordable for every human. And Jillian, Joe, everyone was asking, why are all of these articles coming out about compounding pharmacies saying that it's dangerous for compounding pharmacies to make these drugs? And I explained it to them. Why is there a huge backlog? There's a huge backlog because, one, it's being overprescribed, but two, because Eli Lilly got several of its facilities shut down via a whistleblower. Eli Lilly had a whistleblower that blew the whistle, and that's the only reason the FDA went into their facility. And what they found was unsterile conditions, people working barefoot. They were lying and misrepresenting the dosages and the amounts. I mean, there's a whole article on it. You can go through that Reuters did that breaks down what happened. So the FDA hammered that facility and shut it down. And so that created a backlog where Lilly didn't have it. Here's where it gets dark. They are paying the media outlets that they fund $8 billion a year that Big Pharma puts into the advertising with these media outlets. They are paying them to do stories indirectly, to do stories, hatchet job articles, scaring people away from cost-effective alternatives like compounding pharmaceuticals. I don't even want to give them the credit. Anyways, the article at the end is an advertisement for Eli Lilly. And by the way, Eli Lilly's cutting the prices of Ozempic. They wrote an article about a recall one of my pharmacies had on 28 vials. 28 vials. We've treated over 1 million patient lives. We recalled 28 vials proactively. We didn't know for sure if there was a discrepancy, but in an abundance of caution, we recalled it. 28 vials. Made national news. Why? That's insanity. That should not be national news. And we know the answer why. We know the answer why. And meanwhile, the whole time, the FDA's been in my building 3 times in 18 months. There are over 2,000 pharmaceutical manufacturing facilities that the FDA has not been in 5 or more years. Lilly and Pfizer have moved a huge amount of their manufacturing facilities overseas to third world countries like India. And they put them in rural areas where when an FDA inspector goes out there, they got to stay in a shithole hotel that has no water and shit. And so they don't want to go there. And if they do go there, they have to give them a 3 months heads up because they've got to get visas and green cards and or whatever they call them over there, all these things, and negotiate with the country to go in there for months at a time. And so I just say all that because the narrative that's being delivered in the direction it's headed, anything that's FDA approved, and these pharmaceutical companies are not making these super safe product. But one of the things Trump did, and I'll wrap it up, but Trump, right now, already, Trump said we need to break up the PBMs. He's dead right. Spot on. Good work. He said we need to move manufacturing from overseas back to the United States. That would clean up all of these facilities that these big pharma companies are hiding. And then they're also hiding the dollars, the tax dollars over there, because they're able to hide those dollars overseas and realize those revenue streams overseas, and bringing all that back and putting them right back in this country gives Americans jobs. It creates better oversight. I mean, several of the ideas that they have already floated out are phenomenal.
Yeah, I mean, it's one thing for, Ozempic to be made abroad, but, antibiotics are necessary, and those should be made here.
Yeah.
Just for reasons of national security.
Absolutely.
Brigham, thank you very much.
Thank you for having me. I know it was a lot.
That was the best. You're going to affect my sleep, but I appreciate it.
I appreciate it.